Healthy Living with Van Van warmly greets all my dear uncles, aunts, brothers, sisters, and beloved elder friends. There is a phenomenon that I am sure many of you have experienced, or at least heard about from someone around you. In the morning, just after waking up, you measure your blood pressure and suddenly it spikes. Some people feel dizzy, have headaches, and sadly, there are cases where stroke occurs right in sleep or just as someone gets out of bed. Why is that? Why does blood pressure tend to rise in the morning, at a time when the body should be relaxed and at ease? And more importantly, how can we prevent dangerous events such as stroke or heart attack in those early hours? Today, I would like to take you on a gentle journey to understand this better, and then draw out some simple but invaluable ways to care for ourselves. Why does blood pressure usually rise in the morning? First, we must understand a natural truth about the body. Blood pressure is not constant. It changes according to our circadian rhythm. At night, while we sleep, blood pressure usually drops, allowing the body to rest. But by early morning, around 4 a.m. to 10 a.m., blood pressure rises again. This is known as the morning surge. The reasons are, the body releases more hormones like cortisol and adrenaline in the morning to wake us up. These hormones make the heart beat faster, blood vessels constrict, and blood pressure rise. When shifting from lying down to sitting and then standing, blood pools in the legs. To balance this, the heart pumps harder, pushing blood pressure up. If you have conditions like atherosclerosis, hypertension, or diabetes, your blood vessels are already stiff. A sudden surge in pressure can easily lead to a ruptured brain vessel or blocked coronary artery. Simply put, our body in the morning is like a car restarting after being turned off all night. If the car is old and the engine weak, but you rev it too hard at once, the chance of breakdown is high. Why do strokes often occur in the early morning? Medical studies show that strokes and heart attacks most frequently occur between 6 a.m. and 9 a.m. The reason is that when blood pressure surges suddenly, brain or heart vessels may not adapt in time. I remember a patient of mine, Mr. Wah, 65 years old, in Hanoi. He had long-standing hypertension. Every morning he got up very early, and right after waking, he jumped out of bed and went to exercise in the park. One day, after just a few steps, he felt dizzy and collapsed. At the hospital, brain imaging confirmed a stroke. Fortunately, he was treated promptly. Later, he told me, "Doctor, just because I got up too quickly, I nearly lost my life." That story is a strong reminder. Morning is the most dangerous time for people with cardiovascular disease and hypertension. Factors that make morning blood pressure rise even higher. Besides natural circadian rhythm, several factors worsen the morning surge. Drinking alcohol or smoking the night before right-pointing arrow vessels constrict, blood pressure spikes in the morning. Eating salty food at dinner right-pointing arrow body retains water, raising blood pressure in the morning. Poor sleep or stress right-pointing arrow cortisol rises, the heart is overstimulated. Forgetting to take nighttime blood pressure medicine right-pointing arrow pressure shoots up next morning. Conditions like diabetes, atherosclerosis, obesity right-pointing arrow vessels lose elasticity. In other words, lifestyle habits and chronic diseases can make the morning blood pressure wave stronger and more dangerous. Warning signs that morning blood pressure is dangerous. Many people think, "I'm used to it, my pressure is always high in the morning, no big deal." But certain morning symptoms are red flags: severe headache, especially at the back of the head, dizziness when sitting up, blurred or double vision, numbness or weakness in limbs, slurred speech, chest pain, rapid heartbeat. If any of these occur, check your blood pressure immediately. They may be early warnings of stroke. How to prevent morning hypertension and stroke upon waking. This is the most important part one want to share. You can protect yourself with very simple habits. Don't jump out of bed right away. Stay lying for a few minutes after waking, breathe deeply, relax. Then slowly sit up, let your legs dangle off the bed, gently rotate wrists and ankles. Stand up only when steady. This is the 3 golden minutes rule to prevent sudden pressure spikes. Measure blood pressure in bed. Keep a blood pressure monitor by your bedside. Check before leaving the bedroom. If it's very high, over 160/100ths, sit and rest, take medicine as directed. Don't rush into activity. Take medicine on time. If prescribed nighttime medicine, never skip a dose. Missing one pill can cause a dangerous surge the next morning. Light breakfast, avoid salty dinners. Dinner should be light, low in salt and fat. In the morning, drink a warm glass of water to thin the blood and ease circulation. Gentle exercise. Warm up indoors first, then go out. Avoid running or heavy exertion right away. Choose light walking and deep breathing instead. Stay calm in the morning. Avoid arguments or stress. Practice slow, deep breathing to keep body and blood pressure steady. Doctor's advice: I often tell my patients, blood pressure is like a wild horse. If you hold the reins skillfully, it will carry you far. But if you neglect it and let it run wild in the morning, you may not be able to pull it back. The key message is, never underestimate mornings. Don't let each new day begin with haste. Controlling morning blood pressure means cutting stroke risk in half for the whole day. In over 30 years of practice, I've seen thousands of hypertension patients. Some need lifelong medication, while others achieve stability thanks to healthy habits. I realized, it's not only medicine, daily habits are the golden key to long-term blood pressure control. So today, let me share 5 simple but invaluable habits: walking, breathing, sleeping well, reducing salt, and staying calm. These gradually stabilize blood pressure, strengthen the heart, and reduce stroke and heart attack risk significantly. Walking, a priceless free medicine. Walking gently raises heart rate, dilates vessels, and improves circulation. Blood pressure then stabilizes, avoiding sudden surges. One of my patients, Mrs. Mai, 62, had hypertension of 160/100ths. Along with medication, I advised her to walk 30 minutes daily. At first, she was hesitant. "Doctor, I'm weak, afraid of falling." But she began with 10 minutes in her yard, then increased gradually. After 6 months, her pressure stabilized at 130/80ths, she slept better, and her mood improved. Walking doesn't need to be fast or long, what matters is consistency. You can walk after meals, around your neighborhood, in parks, or with friends for both health and joy. Truly, walking is a free clinic gifted by nature. Breathing, bringing oxygen and peace into the body. Notice how anger or worry makes blood pressure shoot up? That's partly due to shallow, rapid breathing. In contrast, slow, deep breathing calms the body, slows the heart, relaxes vessels, and lowers pressure. Research shows, practicing deep breathing 10 to 15 minutes daily can reduce systolic pressure by 5 to 10 millimeters of mercury. Here's a simple breathing exercise I often teach. Sit comfortably, close your eyes. Inhale through your nose, counting 1, 2, 3, 4. Hold 1 second. Exhale slowly through your mouth, counting 1, 2, 3, 4, 5, 6. Repeat 10 times. This practice not only lowers blood pressure but also cultivates inner peace. Sleeping well, a priceless medicine for the heart. Elderly often complain, "I sleep little, doctor, only 3 to 4 hours." But insomnia itself worsens blood pressure control. Lack of sleep raises stress hormones, forces the heart to overwork, and destabilizes blood pressure. A 6 to 7 hour sleep each night allows the heart to rest. I recall Mr. Lamb, 68. Despite taking medicine, his morning blood pressure stayed at 150 to 160. Turns out he stayed up late watching TV, sleeping less than 5 hours. After adjusting habits, sleeping earlier and longer, his pressure dropped to 130 to 135 in the mornings. Tips for better sleep. Go to bed at the same time, before 11 p.m. Avoid tea, coffee after 3 p.m. Limit late-night TV or phone. Practice gentle breathing, listen to soft music before sleep. Sleep is a natural medicine no doctor can prescribe. Reducing salt, the golden key to stable blood pressure. Salt retains water, increasing vessel pressure. Those who eat salty food have double the hypertension risk compared to those who don't. WHO recommends under 5 grams per day 1 teaspoon, yet in Vietnam the average is 9 to 12 grams, double the safe level. How to reduce salt without losing flavor. Limit fish sauce, soy sauce, pickled foods. Gradually reduce salt when cooking, let taste adapt. Use natural seasonings, lemon, garlic, ginger. Don't place the salt shaker on the dining table. I remember a 70-year-old man who couldn't eat without pickled eggplants. After being hospitalized with blood pressure of 180/100ths, he reduced salt. Within 3 months, his pressure dropped to 135/85ths, and he felt lighter and healthier. Staying calm, the spiritual medicine for the heart. Every time we get angry, the face flushes, heart races, and pressure spikes. Stress, anger, and sadness are invisible enemies of the heart. Conversely, a peaceful, relaxed mind helps stabilize pressure. Ways to stay calm. Learn to let go of trivial things. Enjoy hobbies, gardening, music, reading. Practice meditation, prayer, or simply sitting quietly watching the sky. Meet friends, share joys and worries. One of my patients, Mr. Thin, 72, used to worry constantly about his children, making his pressure fluctuate. Later, he joined a local breathing exercise club, socialized, laughed daily. His blood pressure stabilized, and his medicine dose was reduced. He told me, "Doctor, living joyfully is truly the best medicine." Final words, my dear friends, morning high blood pressure is natural but dangerous, especially after age 50. By changing a few small habits, from how you get up, measure blood pressure, take medicine, to what you eat at night, you gift yourself a priceless shield. Please remember, begin the day slowly and gently. Measure blood pressure regularly. Hypertension cannot be fully cured, but it can be well controlled. And the secret lies in 5 daily habits: walking regularly, deep breathing for peace, sleeping enough, reducing salt, staying calm. These cost nothing, are simple, yet protect your heart and brain, extending life. I truly believe, if you maintain these 5 habits, you'll need less medicine, face fewer illnesses, and enjoy a lighter, happier life. Love your body, for health is the greatest gift to enjoy life with your family. I wish you peaceful mornings, stable blood pressure, and a serene heart. Healthy Living with Van Van looks forward to seeing you again in the next videos.